bit about infection control, universal precautions. The definition of infection control is a set of methods used to control and prevent the spread of disease. Some modes of transmission: body fluids, tears, saliva, sputum, mucus coughed up, urine, feces, and the list goes on. Oh, and also wound drainage. Touching the infected person or their secretions, touching something contaminated by the infected person, droplets, coughing, sneezing, laughing, spitting, talking. Definition of contaminated means dirty, soiled, or unclean. Disinfection, cleaning so that germs or pathogens are destroyed. Mode of transmission, the way germs are passed from one person to another. And everybody knows what mucous membranes are. Membranes that line the body cavities that open to the outside of the body. Portals of entry, any body opening of an uninfected person which allows pathogens to enter. Nose, mouth, eyes, mucous membranes, and so on and so forth. Cuts, abrasions, or breaks in the skin. Who is at risk? I say anyone. Anyone is at risk. Of course, anyone whose resistance to disease decreases, or reasons for someone having a lowered resistance are more, apt to get sick. The elderly have weaker immune systems and lower resistance, and the recovery is longer in the elderly. Some of the universal precautions: wash your hands. I don't know about this, before putting on your gloves, and immediately after. I don't know if we wash our hands before.
True confession.
Have you ever tried to put on a pair of gloves and your hands are wet?
Yeah.
Hand sanitize. Just make sure your hands aren't visibly soiled. Is like what we mean. Not that they're not clean, but like you can't put on gloves with wet hands.
Yeah.
Do not touch clean objects with contaminated gloves. What can I do? Good hand washing is the most effective method to prevent the spread of infection, which Andres taught everybody how to wash their hands.
Yeah.
Yay! You may use an alcohol-based hand cleaner in place of washing with soap and water. Avoid touching eyes, mouth, or nose. Let's see, universal precautions, already said that. It's infection control guidelines designed to protect workers from exposure to diseases spread by blood and certain body fluids. Always treat blood, body fluids, broken skin, and mucous membranes as if they were infected. Always follow universal precautions because you cannot tell just by looking at a person whether they're contagious or not. Clean all surfaces that may be contaminated with infectious waste, such as beds, wheelchairs, shower chairs. What can I do? Cover your nose and mouth with a tissue every time you cough or sneeze. Throw the used tissue in a wastebasket. If you don't have a tissue, sneeze or cough into your sleeve. Always clean your hands after coughing or sneezing. I don't know if I need to go over the hand washing part. It tells you how to wash your hands. Waterless hand sanitizer. Make sure all visible dirt is removed from your hands. Apply a dime-sized amount of waterless hand sanitizer to the palm of one hand, or use a waterless hand sanitizer wipe. Rub hands together, covering all surfaces of your hands and fingers. Rub until the waterless hand sanitizer is absorbed. Remember, waterless sanitizers are not effective if you have dirt visible on your hands. Use the gloves part. Well, when should I use gloves? When you have open sores or cuts on your hands. When should I change gloves? When touching surfaces that may be contaminated. And what was the glove part? Y'all be quiet on.
Doing great. Thank you. Thank you. Thank you.
Now we're going to talk about bloodborne pathogens. Bloodborne pathogens are microorganisms that are present in the human blood and are potentially infectious materials that can cause diseases in humans. Pathogens include, but are not limited to, hepatitis B, hepatitis C, and HIV. All right. To prevent the spread of these, we use standard precautions. They shall be observed to prevent contact with blood or other potentially infectious materials, and that, like Ms. Cindy said, all bodily fluids, ooh, I can't talk, should be considered potentially infectious. The purpose is to eliminate or minimize employee exposure. We use PPE in these instances, and it shall be used where exposure remains. It includes gloves, gowns, lab coats, face shields or masks, eye protection, mouthpieces, pocket mask, and or other ventilation devices. Then we're going to talk about needle stick.
Do the bottom hit. I don't know. They say you gotta hit it hard.
Hit it hard.
Now it's doing it.
Then we're gonna talk about needle stick safety. I know it's, just so y'all are aware, I know there's not a lot of needles on campus. They're mostly contained in the nurse's station, and in the diabetic room. But when you use needles, you never recap them. You use them and you put them in a red Sharps container. Nowadays, there are some needles that have the auto cover on them, or the diabetics, because I know some of the techs can assist the diabetics. The needle is contained, it touches their finger, you push the button, and it's contained in the device. You just put it in the red bin. Never throw them in the trash cans. Activities with potential needle stick injuries. Healthcare workers can be at risk for needle stick injuries or sharp injuries when they handle needles that can be taken apart or manipulated. Needles that have been that are attached to tubings that have been disposed of inaccurately. We don't use a lot of tubing here. Needles that have been manipulated by clients. Our clients really don't have access to those things here. Like I said, never recap of your needles. The biggest thing here, we're real careful in the nurse's station when we do our injections. We do them next to the red bins. We don't take them unless we have a difficult patient. We try not to take them out into the houses. We bring the patients into the diabetic room. We do the injections and we put them into the red containers. So the needles are never out on campus for the patients to ever have access to. And the red containers stay in the nurse's station until, like the guy came today to pick them up. Then they go into a bin, and then he picks all that up. It's never out on site. It's not mixed with the other trash. And that's it. And then we're gonna talk about gloves.
Thank you.
All right, I don't know how many of y'all put gloves on, take them off. It's just real simple, but, so when you put your gloves on, like Miss Cindy said, they recommend washing or hand sanitizer. And then when you go to take them off, so you have both are gloved, you kind of pinch up by the wrist. Amanda will demonstrate.
Yeah.
So you pinch up by the wrist with one hand, and you're gonna pull that off inside out. And then you're holding that in your hand, you stick a finger underneath that glove, and then toss it away, never touching the outside of the glove.
Wow, all right.
Right? The only thing I will add to the needle stick is, not that you guys deal with it very often, but it is so imperative if you were ever stuck by a needle at work that you report it. There's lifelong testing that can be done, whether we know if the patient has anything, we test them, we monitor it for months, sometimes a year, even if it is, because you never know what's going to develop. So it's just so imperative. If it's your second day of work, I don't care, like, your job's never going to be in jeopardy for a needle stick, and it's just very imperative to make sure, if it happens for whatever the reason is, that you report it just for your own safety, that you can be followed up on. So other than that, I think that's it.
All right.